Good morning or afternoon or evening, students, whatever time it is that you are deciding to look at this lesson. But today we are going to be discussing birth defects. We will go through this PowerPoint together, and I will read them each out loud, and I will provide little insights and extra information and things like that that you may need that will help us to feel like we're somewhat still in the classroom and be able to take the best advantage of this school closure. So the first thing that we were going to do with this lesson is I was going to give you an activity, and the activity was top 10 reasons why you believe a pregnant woman needs a banana split. Just kind of a fun, silly activity. And I was going to go around to each of your tables, and you were going to come up with one reason as to why you think that a banana split would be considered healthy for a pregnant woman. It's mainly just a joke, but some of the options were that there's calcium found in ice cream and strawberries and peanuts, which is good for bone development. There's protein found in ice cream and peanuts, which is good for healthy muscles, tissue, skin, and hair. There's vitamin D found in ice cream, vitamin A found in ice cream and bananas, which is good for your eyes. Vitamin C found in strawberries and pineapple. Potassium is found in bananas. It helps regulate your heartbeat. Iron found in peanuts and strawberries, which is good for your blood. Fiber found in pineapple, strawberries, bananas, and peanuts, which is good for your digestion. And fat is found in ice cream, Cool Whip, and peanuts, necessary for proper brain development and for the absorption of vitamins A, D, E, and K. Also flavor. Chocolate is a mood enhancer, and so it triggers the release of the feel-good brain chemical called serotonin. And everybody needs a little self-indulgence occasionally. So it's just kind of a fun little way to get our class started. Normally how we start each child development lesson with either a story, a book, or a song. And then this was my activity for that. And then I was going to have a present for you guys, and I was going to bring out all this type of ice cream type stuff, and we were going to have an ice cream snack. But because we're not in school, I guess we will not be able to have those, so pretend that I gave you ice cream. When we talk about birth defects, there are two different types, genetic and environmental. We've been talking about genetics previously in this class, and so what you guys do understand the difference between genetic and environmental is genetic is not something you have a lot of control over. It is mainly what you get from other people, family members. It's what's inherited. Whereas environmental, you do have some control over environmental. It's based on the situation that you're in and things that you bring into your environment that can cause certain things. So I was going to go ahead and ask you guys what are some specific lifestyle choices that can minimize environmental birth defects, meaning what are some things I want you guys to envision down the road when you decide to have a child and you are pregnant, or your partner is pregnant, or you are bringing a child into this world somehow? What are some things that you would want to do to help minimize your risk of environmental birth defects? Like, would you make sure you weren't taking certain medications? Would you make sure you were eating the right foods? You were staying away from dangerous chemicals, that kind of stuff. So you want to avoid all forms of drugs, nicotine, and alcohol. These can slow the fetal growth and cause low birth weight in babies, and it can cause varying levels of mental retardation and malformations, etc. Fetal alcohol syndrome, which we'll talk a little bit more about as we go through this, is a birth defect caused by alcohol consumption during pregnancy. You only use over-the-counter and prescribed medication under a doctor's care. Always make sure your doctor is aware of what it is that you are taking, and he or she may give you advice on what you should and shouldn't take. You are to avoid exposure from x-rays, pollutants, and toxic substances. You want to get appropriate rest and follow stress management techniques. Seek early and continual medical attention, prenatal care, and maintain a proper diet. The placenta does not transfer essential nutrients to the fetus if a woman is undernourished. So you want to make sure that you are giving your fetus the best proper nutrition. Exercise is also very important. Walking and swimming are excellent during pregnancy because you want to be able to exercise but not overdo it when you're pregnant, and so you want to have low stress activities like swimming would be a really good example. The appropriate weight gain for someone while they're pregnant is 24 to 30 pounds during pregnancy. If you do gain more than that, you are gaining more weight than you should. If you're exceeding the 50-pound range, you are definitely gaining more weight than you should, and you need to make sure you are eating appropriately so that you do not gain an unhealthy amount of weight. There are obviously certain lifestyle choices that can increase the risk of environmental birth defects, and you guys all pretty much know these. You've been taught these ever since you were young, and they are harmful substances that the mother consumes, which can be over-the-counter medication, tobacco, alcohol, illegal drugs, diseases and infections, including STDs and STIs. If a woman has an STD or an STI, you can transfer that into your fetus. So it's very, very important that if you have an STD or an STI, you need to make sure your doctor is aware of this so they can make a birth plan that's appropriate for you. A lot of the times, if you have an STI and you give birth vaginally, you can transfer that STI through to your fetus through the birth canal. And so you want to make sure that you do not give birth vaginally on most cases. A lot of the times, if you have an STI and you are pregnant, part of your birth plan will be getting a C-section to help avoid the passing of that infection to your baby during delivery. The risk for genetic birth defects does increase if the age of the woman, the mother, is over 35. You do have a higher risk of having a baby with Down syndrome if you are over 35 and you have a child. That does not mean that you can never have children when you're past the age of 35. You just need to make sure that you understand that the older you are, there are a few more risks, and you need to be very aware of that. Because if you have a high risk pregnancy, you need to be under very, very strict doctor's orders and very specific doctor care so that you are able to shoot. Sorry, my dog was chewing up my charging cord, so sorry about that. Anyways, learning from home is so much fun. I love this so much. I love when my dogs chew up my laptop cord while I'm recording a video. Anyways, okay. Birth defects can also be caused by defective sperm or ovum cells, which you obviously would not be aware of until you were faced with that situation. The different genetic birth defects are, so meaning these come from your genes, it's what is inherited. You have Down syndrome, PKU, and muscular dystrophy. Those are the three that we're going to talk about. There's obviously way more than that, but we are only going to talk about these three. Down syndrome is caused by an extra 21st chromosome. PKU is a protein deficient birth defect, and it's the inability to process proteins. So your body does not process proteins the way that a normal person's body does, and it can make you very sick. So if you have PKU, you have to make sure you have no meat, dairy products, dry beans, nuts, or eggs. So it kind of sucks because it's a hard diet to follow. Cereals, fruits, and vegetables need to be eaten in moderation. And they can cause, if you have PKU and you do not take care of it properly, it can cause mental handicaps, convulsions, behavior problems, skin rashes, and a musty body odor. So that sounds fun. Muscular dystrophy is a weakness and shrinking of your muscles. It is caused by an abnormal gene, and in more extreme forms, they have a life expectancy of 20 to 30 years. So it is the weakness and the shrinking of muscles. Then we have our environmental birth defects. This means it can be caused by something you take in your environment, which means it can be caused by the woman who is pregnant. While they are carrying you, they are taking in something that is not good for the baby. That's not how all of them are caused, but that's how a good amount of them are caused. Fetal alcohol syndrome is a very obvious one, and it basically means that the pregnant woman was drinking alcohol during her pregnancy. There is STD or STI-related environmental birth defects, and then there are drug-influenced defects. Fetal alcohol syndrome actually is one that can be identified pretty easily physically, because if you have a baby with fetal alcohol syndrome, you will there are certain facial features that come to be, like a small head, a small eye openings, a short nose, and a thin upper lip. Fetal alcohol syndrome causes brain damage and growth problems. The problems caused by fetal alcohol syndrome vary from child to child, but defects caused by fetal alcohol syndrome are not reversible. If you have a child who's born with fetal alcohol syndrome, it's the way they are. You have caused this. There is no amount of alcohol that is known to be safe to consume during pregnancy. If you drink during pregnancy, you place your baby at risk for fetal alcohol syndrome. There are various implications of these types of defects, and they range from distinctive facial features to deformities to slow physical growth, vision problems, hearing problems, heart defects, poor coordination or balance, trouble with attention, poor memory, difficulty with reasoning and problem solving, difficulty identifying consequences of choices, poor judgment skills, rapidly changing moods, difficulty in school, trouble getting along with others, poor social skills, problems with behavior and impulse control, poor concept of time. So as you can see, that the implications here for these defects are great. And if you choose to be irresponsible while you are pregnant, you are putting your child at risk to have these numerous issues. Then you have STI-related birth defects. If a mother has an STD or STI, it is possible for the fetus or newborn to become infected. Some STDs or STIs, including chlamydia, gonorrhea, genital herpes, and I don't even know how to pronounce that, and I'm just not going to, can be passed from mother to infant during delivery when the infant passes through the infected birth canal, which is why I was talking to you about how a lot of women will have a C-section if they have a, and my phone just dropped. A lot of women will have a C-section to help lower that risk. In most hospitals, infants' eyes are routinely treated with an antibiotic ointment shortly after birth. This is to prevent blindness due to exposure to gonorrhea or chlamydia bacteria during the delivery if a pregnant woman had an undetected infection. Because not always, a lot of the times with STDs and STIs, which can be scary, is that a lot of women don't know they have it. And so if they don't know they have it, they're obviously not going to disclose this to their doctor, which means their doctor obviously doesn't know they have it. And so the baby can pass through the birth canal with no one being aware that this is a situation. So because of that, all babies are routinely treated with this antibiotic cream on their eyes, whether the mom has an STD or not, just to be in case if the mother had one and she was not aware of it. STIs during pregnancy can also cause miscarriage and ectopic pregnancy. This is when the embryo implants outside of the uterus, usually in a fallopian tube, and then it will 100% cause a miscarriage. The baby cannot survive in the fallopian tube. And when that does happen, though, a lot of the times it can severely damage the mother. It could cause death if not caught early enough. It usually will cause surgery that needs to be happen. And then also if it's not caught early enough, then it can also, the woman can lose her fallopian tubes or lose her ovaries in that process, which can cause issues getting pregnant in the future. There's preterm labor and delivery before 37 completed weeks of pregnancy. My brother just walked down and he's looking at me really weird because I'm talking to my computer. I am recording a video of my PowerPoint so I can send it to my students.
What the heck?
Say hi, Cody.
Hi.
No, I'm just talking to my students who don't exist right here.
Cool.
Anyways,
Earthquake, right?
I didn't feel the earthquake. Was there another earthquake?
You didn't feel it?
Mandy texted me and said there was one, but I didn't feel it.
It was a 4.6.
Seriously?
Yeah.
How did I not feel it?
I don't know. I just showed up there.
Was it scary?
Not horrible. Not as bad as the last one.
I didn't feel it.
Yeah.
See?
Pretty big.
I was too busy teaching my child development students and I didn't feel the other earthquake. It's been crazy. See ya. Okay, so back to where I was talking about. Sorry, guys. Preterm labor and delivery. This means that you could end up with preemie babies, which can cause a whole slew of issues as well as very high medical bills. A low birth weight, certain birth defects, a stillbirth, illness in the newborn period, and newborn death if it is the extreme. There is a combination of genetic and environmental birth defects, and these can be known as the cleft lip palate or cerebral palsy or spina bifida. So, the cleft lip or cleft palate, you can have either, or both, but as you can tell with the picture of the baby on the left side of the screen, you can see that the hole goes up into their nose. That is a cleft lip, whereas the next baby has a cleft palate. It's where there's a hole in the roof of the mouth. So a cleft lip happens if the tissue that makes up the lip does not join completely before birth. This results in an opening in the upper lip. The roof of the mouth, which is also known as a palate, is formed between the 6th and 9th week of pregnancy. So a cleft palate happens if the tissue that makes up the roof of the mouth does not join together completely during pregnancy. Children with a cleft lip with or without a cleft palate or a cleft palate alone often have problems with feeding and speaking clearly and can have ear infections. They also might have hearing problems and problems with their teeth. Most children who are born with a cleft lip or cleft palate will have surgery to repair the damage that has been done to their mouth. Some factors that increase the chance of having a baby with a cleft lip or palate. Women who smoke. If you smoke during pregnancy, you are more likely to have a baby with a cleft than women who do not smoke. This does include vaping. Diabetes. Women with diabetes diagnosed before pregnancy have an increased risk of having a child with a cleft lip with or without a cleft palate compared to women who did not have diabetes. And then the certain use of medications. Women who use certain medications to treat epilepsy, such as topiramate and valproic acid, during the first trimester, the first 3 months of pregnancy, have an increased risk of having a baby with a cleft lip with or without a cleft palate compared to women who did not take these medications. Cerebral palsy is a condition in which it's a group of disorders that affect the movement and muscle tone or posture. So where you had muscular dystrophy, that was where your muscles were shrinking and they were weak. And people had, if it was a more severe case, they had a life expectancy because their muscles were dying away. Cerebral palsy, your muscles are not shrinking and they're not dying away, but they are, the movement of your muscles and your tone or posture are affected by cerebral palsy. It is caused by damage that occurs to the immature brain as it develops most often before birth. And it can be caused by gene mutations that lead to abnormal development, maternal infections that affect the developing fetus, and fetal stroke, a disruption of blood supply to the developing brain, bleeding in the brain in the womb or as a newborn, and infant injections that cause inflammation in or around the brain. Traumatic head injury to an infant from a motor vehicle accident or fall. And lack of oxygen to the brain related to difficult labor or delivery, although birth-related asphyxia, which is when the baby loses oxygen while they are being delivered, is much less commonly a cause than historically thought. Spina bifida is also known as neural tube defect. This is a really big one, and I'm pretty sure they asked this question to you in your end-of-level skills test. If you guys are taking that test at this point, I'm not sure, depending on how long the school closure lasts, but it's important that you do know spina bifida. It is the developing baby's spinal cord. It's when it improperly develops. Normally, the neural tube forms early in pregnancy, and it closes by the 28th day after conception. Most women do not even know they're pregnant when it's 28 days after conception. So it's hard to be able to tell if your baby's going to have spina bifida or not. That's why it's super important that if you are sexually active, you are very, very smart about this. If you are planning to get pregnant, you are having sex in the purpose to make a child, you need to be aware that you need to be on prenatal vitamins before you even get pregnant, or you're eating foods that are strong in folate or high in folate so that your baby has what it needs properly to form. In babies with spina bifida, a portion of the neural tube fails to develop or closes properly, causing defects in the spinal cord and the bones of the spine. This picture is of a baby who had surgery on their neural tube defect or their spina bifida while the mom was pregnant. It's called fetal surgery, and it's when they go in and they perform surgery on the fetus while it is in utero with the mother. This baby, you can tell that it had surgery while it was in utero, and the spine was closed up, and that's what it will cause to heal. This baby may be paralyzed. I don't know the story of this baby, but that is definitely a risk of spina bifida. Women of childbearing age who have inadequate folate intakes are more likely to give birth to babies with spina bifida. Damage occurs during the first weeks of pregnancy before a woman may realize she is pregnant. This may be prevented if a mother takes folic acid prior to conception. This is just a diagram of a baby with spina bifida. It's an open defect. You can tell that there is a spinal matter and spinal cord and fluid on the outside of the baby. So if we go back to this picture, you can see that this is where the surgery took place on the baby's back and on its spine to have that issue corrected. So there are different tests that you can do to detect birth defects. Your first one is going to be an ultrasound, and it utilizes sound waves to detect the health and development of the fetus. And then you have an amniocentesis. So your amniocentesis, I feel like I'm saying that wrong. Anyways, your amniocentesis is a test where the doctor inserts a needle through the abdominal wall and into the uterus and withdraws some of the amniotic fluid to detect for birth defects. And then they test that amniotic fluid. I did attach a video showing an amniocentesis. It's not super gross. It's not like queasy. It doesn't make you, it's not gross at all. It just shows the doctor putting a needle in the mom's stomach and taking out an amniotic fluid. So if you would please watch that video, pause what I'm saying right now, click on the link, watch the video, and then come back and play what I continue to say. And then the next day we will be going into childbirth for our next lesson. Now, this is where I'm very upset about the school closure because I wanted to go through this with you in great depth and I had lots of different things I wanted to show you and it was going to be a really big day. So it's going to be a difficult lesson for sure to go over just with my voice and I'm kind of bummed about that. But I will put this together and do the best I can. It is very important that you are following along with your note guide while you're doing this because you will still be submitting that somehow, some way, I'm not sure yet. And also it is very important that whenever you see a video link within these video lessons of my voice, you click on the links, you pause what I'm saying, you click on the links, you watch the videos because it's important that you see this. I know that a lot of you are really grossed out by childbirth, but again, it is a natural part of life. It is something that you need to see. It is something that is a learning experience that I would like you to see. So if you would please watch those videos, I would really appreciate it. And it will help you in the long run much more to be able to visually see it. That is going to end our lesson for today on birth defects. And I hope you guys have a great rest of your day. And I miss you. And I can't wait until we can see each other again.